The overall goal of joint replacement is to return people back to their lives, letting them do the things they love, be with the people they love, really get back to feeling like themselves.
Patients want to continue to be active, they want to be able to go for walks, they want to be able to travel, they want to be able to work on their garden. So once they get to a point where they can't do those things anymore, they're ready.
The majority of patients we see are probably somewhere between the age of 40 and 80, mostly for, again, osteoarthritis, meaning the joint wore out. Every now and then I will see younger patients in their 20s, some as young as 14 and 16 who have unfortunate conditions that led them to need joint replacement much earlier. We can replace almost any joint, but probably hips, knees, and shoulders are the most common ones you'll see, with ankles becoming more common.
For both hip and knee replacements, we've seen studies that have shown that as long as your surgeon does 20 replacements a year and they do it in a hospital that does a minimum of 50 a year, your chances of success are very good. At Texas Orthopedic Hospital, we have 6 orthopedic surgeons that specialize in joint replacement surgery, and each one of us does between 500 and 600 replacements a year, meaning that the hospital does almost 3,000 replacements a year.
I have just an amazing group of all-star surgeons that I work with, and they've really set the tone at this hospital. Everyone who works here is really devoted to what they want to do. We have amazing nurses on the floor who are energetic, who are focused on the patients. We have amazing staff, from the physical therapists, the occupational therapists. Everyone is just really warm and friendly and really pulling in the same direction. We want patients to just have a great experience here and also get the best result.
We have received numerous awards, and we are #1 in patient, physician, and employee satisfaction. One of the things that we are proud of here at Texas Orthopedic Hospital is that we are advanced joint certified by the Joint Commission, and we're one of the very few hospitals in town that have this certification.
In my opinion, this is the best place in Texas and one of the best in the country to get your joint replaced. Some places might be more convenient, but there's no place where you have a collection of this kind of knowledge and expertise when it comes to joint replacement.